This video is designed to show the great toe sprain week 1 protocol. Short-term goals are as follows: decrease pain, decrease swelling, increase range of motion. Immobilization recommendations are as follows. Days 1 through 4, fully immobilize with a stiff sole insert or stiff sole shoes. Days 5 through 6, increase mobilization during rehab. However, throughout the day, have the athlete wear, again, immobilizing shoes with stiff soles or a stiff sole insert placed inside athletic wear. Day 1, begin with whirlpool for 15 minutes. Inside the whirlpool, have the athlete perform the following exercises: ABCs, do 3 sets of 10. Following the cold whirlpool exercise, have the athlete begin non-weight bearing BAPS board exercises. Suggestion, 2 sets of 10. At the end of day 1, again, immobilize. Day 2, begin with cold whirlpool exercises, working on toe range of motion, a flexion and extension of the toes, abduction and adduction for 15 minutes, followed by golf ball rolls to increase range of motion, decrease pain, and decrease edema for 5 minutes. At the end of day 2, again, immobilize. Day 3, begin with the ice bucket. Have the athlete perform ankle pumps inside the ice bucket for 10 minutes, doing 3 sets of 10. After this is complete, then have the athlete prepare for stretching. We will be stretching the lower calf, lower leg, foot, and toes. Day 4, begin with a bike warm-up for 20 minutes. Following this exercise, do calf raises on a pain-free arc with the patient seated. Do 2 sets of 10. The following exercise will be ankle 4 ways without a TheraBand. Do 2 sets of 10. To end day 4, have the athlete do range of motion and ABCs in the cold whirlpool for 15 minutes. Day 5, begin with the athlete warming up on the bike for 20 minutes, followed by having the athlete work on range of motion, non-resistance for 2 sets of 10. The next exercise will be cotton balls and cups or toe pickups. Have the athlete pick up an object, place it on the floor, again, picking it up, placing it on the floor for 2 sets of 10. To end day 5, have the athlete do an ice cup massage on a stretch for 7 to 10 minutes. Beginning of day 6, this will be an aquatic therapy day. We will begin with the athlete doing 2 laps walking forward in the pool. Then the athlete will do 1 lap walking backwards. The athlete will then do heel walks and toe walks for 1 lap in the pool. Followed by single leg calf raises in a pain-free arc. Do 2 sets of 10. This concludes week 1. Week 2 of great toe sprain. Short-term goals: increase range of motion, increase surrounding muscular strength and stability, neuromuscular control, and return to play. Immobilize for the first 7 to 8 days. Full immobilization should be complete by day 9 through 12. Beginning with day 1, have the athlete begin with a warm-up for 20 minutes on the bike, followed by heel-toe walks, 3 sets of 10. The athlete will then do toe curls and extensions. Do 2 sets of 10. Then the athlete will have toe therabands. Do 2 sets of 10. This concludes day 7. Day 8, again, have the athlete begin with warming up on the bike for 20 minutes, followed by calf raises. Do 2 sets of double calf leg raises and 2 sets of single leg. The following exercise will be towel curls. Do this exercise 3 times. The next exercise will be paddle boats with a TheraBand. Do 2 sets of 10. This concludes day 8. Day 9, begin with the athlete doing a warm-up for 10 minutes on the elliptical, followed by single leg calf raises, 3 sets of 10. The next exercise will be monster walks on their raised on their toes. Do 3 sets of 10. Followed by bear crawls, again on their toes. Do 2 sets of 20. This concludes day 9. Day 10, again have the athlete warm up on the elliptical for 10 minutes, followed by heel toe raises on the AirX pad, 3 sets of 10. The next exercise will be towel pulls. This time, add weight. The next exercise will be towel pulls with added weight. Do this exercise 4 times. The last exercise will be toe squeezes. Hold for 30 seconds and release, and do this 4 times. This concludes day 10. Day 11, begin with the athlete doing a warm-up on the treadmill for 10 minutes, followed by towel pulls with a weight. Do this exercise 4 times. The following exercise will be squats raised on their toes, do 2 sets of 10. The next exercise will be lateral cutting or side shuffles. This concludes day 11. Day 12, begin with a warm-up on the treadmill for 10 minutes, followed by squat jumps, 3 sets of 10. The following exercise will be sprints for 30 seconds, 4 sets. The final exercise for day 12 is lateral bounding. Do 3 sets of 10. This concludes the 2-week protocol for great toe sprain.